All right, we'll go ahead and get started. Thank you all for being here for Monday's COVID-19 vaccine media availability. I've got a full slate today. We'll have James English from the Washington County Health District and the COVID-19 operations, as well as Carissa Loper, who is the Deputy Bureau Chief for COVID-19 for the state, and Melody Osborne from Renown Health. So we'll start it off with James English. James, if you're ready, please go ahead.
Good morning, everyone. So Thursday through Saturday, we dispensed over 1,643 first doses here at the Washington County Health District and an additional 2,141 second doses. Today, we're completing approximately 800 first doses, and tomorrow we'll be doing our first pod with the Janssen product with about 1,050 appointments scheduled. Thursday, we'll be doing first doses again. Throughout the remainder of this week, we're operating 6 days, 3 of which are first dose pods. The remainder are either first dose and second dose operations. Next week, we'll be operating 6 days again, but we're actually increasing our first dose pods to 6 days or 5 days a week. So 5 of those 6 days we'll be dispensing first doses. Per the state of Nevada dashboard, which was updated on March 4th, we're at 16.77% of Washington County residents receiving at least one dose, and 9.77% of our population is fully vaccinated, which is slightly higher than the national average. Finally, we have finished transferring out all the Janssen vaccine we received last week to our regional partners for use in the community, and it'll continue to be dispensed throughout the week and into next week. Truckee Meadows Fire Rescue will be up in Gerlach tomorrow, vaccinating all groups that are open, either in the general population lane or the essential workforce lane. And we've also received our vaccine shipment for this week, so we are set to go through next Tuesday. And then finally, we are switching next week from the Patagonia scheduling system to the Salesforce scheduling system, and that's why you're seeing the ramp up next week with appointments. With that, that's all I have today.
All right, thank you, James. In addition to that, we sent out over 4,000 emails to seniors 65 and older, inviting them to schedule COVID-19 vaccine appointments. We did that on Friday and Saturday for a total of 4,000. So we advise that people please check their email inboxes, their spam folders, and if you know a senior, whether it's a colleague, family member, or friend, to reach out to them to see if they need any help, making sure if they did receive an invite that they go ahead and get that scheduled. With that, I'll turn it over to Carissa Loper, who's with the state of Nevada. Carissa, if you're ready, please unmute and give us an update.
Hi, thanks, Scott. Good morning, everyone. So I'll give an update just on the 2 technical bulletins that were released from the state last week. The first is on underlying health conditions and how providers and counties can serve those with underlying health conditions, including all of those on the CDC's 2 lists. If you check their lists of underlying medical conditions, both on our technical bulletin, it matches with the CDC's list of those who are at risk and those who may be at risk. The other point of this technical bulletin to providers is to help guide us as we have increased vaccine supply coming to us throughout the next months, that we will be working to recruit and enroll more vaccine providers, including private healthcare providers who can serve their patients, those who are on the eligibility list, and then ideally, as we reach summer, everyone. So the idea here is to give them an idea of how to serve those and to let the counties know that the most appropriate way to serve those with underlying conditions in public pod settings is to do so following an age band recommendation. So especially as we have limited supply, we can increase following an age band recommendation, and the counties will be they will be doing that at their discretion as they follow their own immunization coverage rates in their counties. The second technical bulletin I want to discuss is the one regarding considerations for implementation of using the Janssen product, also known as the Janssen or Johnson & Johnson product. These all are names that are interchangeable and are used to describe this current 1-dose product that is out for use in the community now. The considerations for that are to, while it is in especially limited supply, that vaccine is to use it when you need to in situations, especially those requiring off-site movement of the vaccine. This vaccine is much more minimal to being moved around and jostled around, so is best for use on off-site clinics and temporary clinics that don't have stable storage, for example. Other options for using this vaccine are to offer it in settings where individuals may want a single dose as opposed to a second dose or a 2-dose vaccine. And again, as we have limited supply, to use that in settings that can reach those who may not be, those who are harder to reach for a second dose, harder to call back, those who may not have cell phones or technology easily available to them, for example. But again, it is in limited supply, so it is with the counties right now to help determine the best providers and places to use the Janssen vaccine. And that's all from me, Scott. Thank you.
All right, thank you very much, Carissa, for that update. We'll now go to Melody Osborne from Renown Health, and then we'll open it up to Q&A for all three of our presenters afterward.
Good morning, and thank you for the opportunity to provide this update. Since January 14th, when Renown began vaccinating the general public based on the tiered approach, we have completed more than 38,000 vaccines to date. And this includes our Tier 1A medical staff members, as well as Renown employees, students, volunteers, and seniors in our community. This week, we plan to administer around 2,100 doses for dose 1 vaccines, as well as 1,500 dose 2 vaccines. As we've mentioned in the past, all those who are eligible and have created a Renown MyChart account are on the waiting list. We just ask that you please be patient. We are updating open vaccine appointments for the limited supply of vaccines that arrive on a weekly basis. I would just also encourage the community to please continue to check the covid.renown.org website for more updated information. And thank you, Scott. Those are my updates.
All right, appreciate that, Melody. We will now open it up for question and answer. We have James English, Carissa Loper, and Melody Osborne from Renown on. Please go ahead.
Hi, James. This is Kenzie with News 4. You mentioned that you guys were doing your first Janssen pod tomorrow. Is that for the seniors that you sent the advisory out to, or is that for your end-to-end supply chain, or both?
That's actually for both. So we have the essential workforce lane, and the employers tend to take a little longer to ramp up. Our schedule is only open a week in advance based on vaccine availability and what's in our building. So we always continue to invite seniors to fill out any open slots. So it'll be a combination of both 65 and older and essential workforce in the end-to-end groups.
And how much longer do you estimate that end-to-end will be? How's that coming along?
It's a very slow process. I fully expect us to be in this group and in that larger group for the remainder of this month into April. Next week, we will be pushing out large numbers of appointments and scheduling invites to these groups. Actually, hopefully sometime later this week when we get the new Salesforce scheduling system in place. And then we'll see a large ramp up here at the Health District with the essential workforce.
This is Paul Nelson with 2 News. It's really a question for all three of you. The CDC guidelines came out for people that have had they've been fully vaccinated. Do you guys have a comment on those?
Paul, can you clarify just more? I mean, there's a ton of CDC guidelines. What more specifically are you talking about?
So the CDC guidelines that came out regarding once you're fully vaccinated, whether you can go back to doing some of the things you used to do. If you're with other people that have been vaccinated, you don't have to wear masks. But if you're out in public, you should still continue to wear masks until they find out for sure whether or not this will stop the spread among people. Do you guys have comments on that?
I know James is more obviously in our for pod and vaccinations, and handling a lot of the operational stuff from there. But I can work on getting you a better comment from the health district in terms of the CDC guidelines. I don't know if any of our other speakers have a comment or not, but I'll pass it to them.
This is Carissa Loper. I would say it just came out this morning, Mr. Nelson, so we do still need to review it on our side and see how it impacts any guidance or recommendations we have from the state immunization program.
When it comes to the vaccination process, are you guys starting to see things really kind of start to snowball now in terms of more and more people are getting vaccinated?
If you're asking that of the health district, we are seeing more individuals get vaccinated. We're also seeing a lot of second doses. So we're seeing complete vaccinations being done at this point. And looking at some of the increases in vaccine allotment, I think our private partners and our pharmacies will really be ramping up over the next couple of weeks. So I do think progress is starting to finally click and continue to increase as we move along into this vaccine process.
Hey, this is Jerry Davis with This Is Reno. Can you tell us what is our total vaccine allotment that's coming in or came in this week?
Washoe County itself got 9,550 doses. So that's what came to our local region and all the providers we have signed up through the state immunization program. Additionally, I don't have the numbers in front of me, but I believe close to 5,000 doses came into our pharmacy partners this week. So we did see an increase quite a bit this week in vaccine, and we hope for that to continue, or at least at that levels will allow us to ramp up operations across the region.
And how are we doing on people making it to their second appointment for those who are getting Pfizer or Moderna?
We are actually seeing right now about everyone coming back. We get a handful of people that don't show up on any given day, but most of them are actually rescheduling. So I would think, without having the data in front of me, we're probably at about 97 to 99% of people coming back for their second doses at some point within the CDC guidance. We still automatically schedule them out 28 or 21 days in advance based on which vaccine they get. And based on personal situations, sometimes they have to reschedule.
And just to add to that, we are also seeing the same from Renown, and we actually call all patients who have not shown up for their second dose to make sure that they are scheduled. And oftentimes we are finding that they were able to receive that at a pharmacy, or we get them rescheduled for a second dose.
Now that we're seeing Janssen administered throughout the community, are we seeing any side effects, any negative reactions, or anything of that nature?
I have not heard of any of that through the health district at this point in time, but it has really only been in the community for about the last 3 to 4 days, and the health district itself has not provided this vaccine yet. We will tomorrow, so I'll have a better answer on Thursday if we saw any sort of reactions, and maybe Ms. Loper knows if she's aware of any.
I am not aware of any.
Any other questions for either of our guests? All right. Thank you to Carissa and Melody for joining us, and to James English as always. We'll be back on Wednesday with District Health Officer Kevin Dick. If you have anything in the meantime, feel free to reach out to me, and thanks again everyone for being here.
Thank you.